Hello, welcome again to the Platinum Mensa podcast and YouTube channel. My name is Dr. Adewale. Thank you very much for listening and thank you for watching. If you've not previously subscribed, please do so now. As we continue to bring awareness to men's health in this month of June, today I want to take a moment to focus on our heart health. Do you know how healthy your heart is? What if I told you that heart disease is the number one cause of death in both men and women in the United States? Unlike women that pay attention to the signs and symptoms, men notoriously ignores those symptoms. They often present to the hospital only when the symptoms become unpalatable or becomes unbearable. Why is this so? Why don't we pay attention to things that could potentially portend badly for us? That chest pain you've been having off and on, that burning sensation in your chest, that shortness of breath you have when you exert yourself or when you climb the stairs, that pain you just feel on your chest that you think might be musculoskeletal. This might be sentinel signs or warning signs that you may have underlying heart condition. Like I always said, prevention is better than the cure. That's why it's important for us as men to perform the necessary preventive care to identify the risk factors for heart disease. Do you even know if you have risk factors for heart disease? Well, there are modifiable risk factors such as high blood pressure, diabetes, high cholesterol, smoking, obesity, use of drugs. These risk factors are modifiable. If you get screened and we identify this risk factor, we can effectively help you manage them so they do not count towards your risk of having heart attack. The one of the few non-modifiable risk factors we do have is family history. So if you have a family history of heart conditions or heart attack in a younger age, that means you actually have to particularly pay attention to your heart. So if you're a man out there that have not had a baseline cardiovascular screening performed, let's take this month of June to get started. Get a baseline EKG, get an echocardiogram, get a stress test done. And if you can afford to, get a CT scan of your coronary arteries to see if you have plaques build up over time. Those are the little things you can do to help stratify your status if you're high risk, intermediate risk, or low risk candidate for heart attack. The more you know, the better aware you have, and the better you take care of your heart. So in this month of June, let's pay attention to our heart. Let's strive to be heart healthy. The goal is a healthy heart is a healthy life and a longer healthy life. So pay attention to your heart. If you enjoy what you've heard so far, please share with your friends that are men out there or with your husbands out there and like the channel. Until next time, where I'll discuss risk factors for colon cancer and prostate cancer and how we screen effectively for them. Stay safe and stay healthy. My name is Dr. Adewale. Thank you for watching and listening.